Hi everybody, Melissa here, and today's presentation is on rejection sensitivity. And so this is a very common symptom of PMDD, but one that we may not be talking about quite as much as we should be, and one that can have very harmful effects on us, especially if we can't identify it and don't know what to do when we're experiencing it. So let's go ahead and get into it. And so rejection sensitivity is feeling deeply sensitive to what others think about us or how we may perceive them to think or feel about us. And so we may not actually know how they feel, but we may assume that they're thinking or feeling a certain way about us. And we experience rejection sensitivity as a result. Now, as I mentioned, this is a common symptom of PMDD, and it's part and parcel with having a mood disorder and experiencing dysphoria. Unfortunately, rejection sensitivity is not talked about a lot as a symptom of PMDD. It is more recognized as a symptom of anxiety, especially generalized anxiety disorder, as well as ADHD and ADD. But with those of us who are living with PMDD, we know that this is a very common symptom. And as we go along in this presentation, we'll have an even greater understanding of how this shows up. And so rejection sensitivity can feel like a lot of things, all things that we're very familiar with as people with PMDD. So it can feel like we are withdrawing, like we're experiencing rage, outbursts of anger, crippling low self-esteem, and severe anxiety. And so we all know these are very common symptoms of PMDD, ones that we are all too familiar with, but they can fall under this umbrella of rejection sensitivity, especially when these symptoms of anxiety, rage, or withdrawing are in relationship to how we are perceiving someone else to feel about us. That person may be a parent, it may be a partner, it may be a coworker. And so rejection sensitivity can show up in all aspects of our life too. It is not just in one area. And so with that in mind, people with rejection sensitivity can find difficulty in having long-term relationships, employment, and they may frequently isolate themselves, as we know many of us do during the luteal phase of our cycle. Rather than subject others to our foul moods or be at risk of having an outburst, we may choose to isolate. And this can make it very difficult, especially going to school or being employed in a workspace that requires you to come in office, because it's not easy to isolate then, and we may have high anxiety and feel withdrawn in social situations where we are expected to act normally. And so we can see that rejection sensitivity can have some serious ramifications to our everyday living. And so other signs of rejection sensitivity that are not just the feelings can include having overly high standards for ourselves that may not be achievable. So we may often set ourselves up for failure by taking on too much and then experiencing a sense of rejection when we're not able to meet the standard we have set for ourselves. Another very common symptom that I'm sure most of you can relate to is frequent and intense rumination after an interaction. So that may be where you replay a conversation that you've had over and over and over again, and you analyze the other person's reactions, their body language, how you may think that they thought about you. And so these periods of rumination can make it really difficult to just enjoy oneself after meeting up with a friend or having a meeting at work, where we may analyze and misinterpret the experience. Another very common symptom is taking things extremely personal, where something that may have nothing to do with us, someone may be having a bad day and having a bit of an attitude or not feeling well, and we think that it's because of us. And so we may also feel a loss of ourself during conflict. So maybe we have a disagreement with a loved one, and we're then only able to see the negatives. Maybe feeling intensely like the relationship is over because of a disagreement, seeing only the issues, none of the positives, none of the aspects of the relationship that may have been why you entered into it into the first place. And then finally, extremely strong, almost unbearable emotions. And so this may be when you don't even recognize how you're responding. This is the PMDD monster that many of us can relate to and talk about, where our reaction is so over the top and so not who we think that we are, that it's almost like this other being comes out of us, this monster or this demon, as we may identify it. And so these are all symptoms of rejection sensitivity. And knowing that these are signs that that's what we're experiencing, we hopefully can do a little bit to mitigate the effect. And so how can we use therapeutic yoga to help recognize when we're experiencing rejection sensitivity and reduce our reactionary response, hopefully making our life much easier in doing so? And so bear with me, because I know that these may seem fairly simplistic, but we want to keep this very, very simple with a reason. Because oftentimes when we're experiencing rejection sensitivity, we're spiraling. And so taking a moment to first recognize that that's what is happening, and saying, this is rejection sensitivity. This is a symptom of PMDD. This is not who I am. And so naming that experience and then journaling briefly what you are feeling bodily. How does it show up for you? Are you experiencing tightness in your chest? Are you noticing that your heart rate is pounding? Are you noticing that maybe you have gotten sweaty, or that your shoulders are tucked up beside your ears? Notice what you're feeling physically and use that to help identify that this is a symptom. This is not who you are. Reflecting and having this moment to pause can help us to make better decisions about how we handle rejection sensitivity, rather than continuing down the line where it spirals out of control. And so after the pause, we want to take very easy action. So we're not going to do anything really big yet. First, we just want to take some deep breaths. We don't necessarily want to be running off to do some sort of complicated yoga practice. We don't want to be seeking anybody else right away. We just want to first recognize and then breathe into the fact that this is rejection sensitivity that we're experiencing. Taking a moment to drink some water and making sure that we're hydrated can help too. Helping to calm our nervous system a little bit and cue our body that we are safe, that the feelings that we're experiencing are not necessarily the truth of the situation. This is also a great time to adjust your surroundings. So if you've been sitting in your office, or if you have been fighting with your partner inside your house, take this time to go outside, go on a little walk with your pet, or go on a walk by yourself. Take a moment to adjust the scene. And you can think of your life almost like a play. If this scene is not serving you anymore, transition to a new one. These easy actions can help us to shift just a little bit so that we don't continue to slide down that slippery slope into having an outburst or going on a kind of deep She-Hulk type rage, allowing us to take a little bit more control over how we're feeling. And so when you feel ready, we can work to reduce overstimulation with a very gentle yoga practice called Shitali. And so making a taco tongue, which is simply curling the edges of the tongue together, You can close your eyes, and as you breathe in, gently lift your chin upward. And then as you breathe out, take the palms of your hands and gently cup your eyes, creating a barrier to the light, helping your body to relax and be more present. Doing these practices can help to reduce stimulation and again, further cue your nervous system that you are safe, that it is okay to relax, and that the symptom you are experiencing is not the truth of who you are, that you are more than rejection sensitivity. Furthermore, instead of feeling like we have to isolate completely, when we notice that we're experiencing rejection sensitivity, we can use that as an opportunity to reach out for some help, especially to people who understand our situation and can be helpful and beneficial to moving out of our fight or flight response. And so this may be a great opportunity to reach out to your therapist or an online support group. The IAPMD has some amazing online support groups that you can make use of. And of course, many of us have a PMDD bestie, someone who also experiences PMDD and knows what it's like. And ideally, this person is not involved in any way with whatever has triggered your reaction. And they can help you to feel like your response is normal, that you are not a monster, and that you can calm down and move forward. Now, of course, we also can try to borrow some energy from someone else using a hug. Now, of course, this person should not be part of your conflict. They should not have been someone who triggered you. This can also be a pet, but a nice long hug, sharing some space, breathing, and having a moment to connect to another person's nervous system that may be more calm than your own can be extremely helpful. And so, again, when we find ourselves ruminating, one of the things we can remind ourselves is that our thoughts are like clouds that pass along the sky. The sky is who we are. The clouds are just simply going to pass, and there will be more clouds some days, less clouds on other days. You are the thinker and not the thought. Let the clouds pass by, let your thoughts pass by, and know that you do not have to specifically identify with them. You don't have to try to solve anything. You don't have to figure it out. Just allow the moment to pass with as much ease as possible. This can be further facilitated by lying down and putting your legs up in the air in a position we call legs up the wall or waterfall pose. This again is a great way to cue your nervous system that you can relax, inverting gently to allow blood flow to come from the feet downward, allowing your body to just simply rest and be. And as you take this time to lie down with your legs up, practice slow, even in and out breathing. Let your only focus be your breath instead of following the thoughts in your mind. This can help you feel like you have a little bit more control over what is happening. And also, you do not have to do much in order to accomplish this. This can feel a lot better than being stuck in a spiral. And so remember, being able to identify and redirect rejection sensitivity is a huge step in symptom management. And although most of these practices may seem small, if you can utilize them in the moment, you are well on your way to having a better luteal phase experience. These practices can help you to change the trajectory of a moment where maybe you don't lash out, maybe you don't have to isolate, and maybe you don't harm yourself spiritually and mentally and emotionally in this spiral of rejection sensitivity. It's not to say that we won't continue to experience it to some degree, but having the ability to identify it and some tools to help manage it are wonderful. If you have any questions, please let me know. Thank you so much for following along with me today. I hope that you have found this helpful. See you next time.